today we are here to talk about the Multiflow system that is actually an idea that you had for more than 10 years. Could you tell us why you came up with the idea and how it works?
This is actually a very, very small thing in our daily work, but it's a thing that everyone needs in their work. We have to evacuate saliva, we have to evacuate blood, and I do a lot of surgery too, so I really have the need for a suction system that can evacuate everything quickly and efficiently. And therefore for some years ago, that's right, Jan, I made some drawings about ideas that I had. Actually, it came from my vacuum cleaner at home. When I couldn't move it on the carpet, I opened up on the handle and I still could use my vacuum cleaner with a little more air. This is why the Multiflow also consists of more than one opening, which means that you can, if I put it in between my two hands, and you see that I turn it around, I will never be able to close this totally. There will always be at least one or two openings that you see here that will efficiently take away the water, saliva, whatever I need. So this is actually a very, very small design, but it's a very crucial design because we need this one every time we have a patient in the chair. For my dental hygienist, who often works alone, she has to use both hands. And with this one, she doesn't have to twist or wrinkle her wrist anymore. She can just place this in whatever position she likes. I have proved that it is more efficient by testing it with 2 glasses of water, making a conventional suction tip and this one, and I get around 30% quicker evacuation, more efficiency.
Does it also remove debris, because some of the existing ones are actually not pulling the debris out of the mouth of the patients?
That was one thing that I didn't think about in the beginning, but I have found out that if I have small tooth fragments or whatever, I just take this Multiflow tip towards this debris and it takes it away at the same time. Earlier we had to take off the tip, or we have to take the large number to take it away, but this one can do it at the same time. And it will never clot, it will never stop. And with the conventional tips, we have seen that they stick to the saliva, to the gums. And when you have to remove them, the patients feel uncomfortable because you have to tear them a little apart. Doesn't happen with this one.
You also told me that this was actually, for the patient point of view, a bit more comfortable to have in the mouth, and it could also be reduced in sound as well.
Yeah. If I turn around here and take one which is a standard tip, you can imagine if this goes into the tongue or into the cheek, they don't feel it very comfortable. Compared to this one, you don't have to speak a lot about it because everything is rounded here. So when you touch the tongue, when you touch the cheek, they will not feel any uncomfortable feeling. And as I told you just before, this one you have to turn around to get it to fit the opposing side, the actual side I should say. This one doesn't have to turn, it goes.
So Flemming, sometimes when you are, as a dentist, adopting new products, they can be time consuming, they can have a need for courses or things like that. But how difficult is it actually for you as a dentist to start using the Multiflow system in your everyday business?
I fully understand your question because it often is like that, whether we have to collect some knowledge before we use the product. This is a daily common product. You just have to change from you used to use and use this one. And we have it here in two, and it's of course in 2 different sizes. The one in yours is handhold, and this one which is just placed in your cheek.
So Flemming, my last question, do you have any direct comments from your patients when you have tried the Multiflow system on them?
Yes, I have. And I have, because I have like invented and had the ideas, I'm of course more interested in have feedback from the patients. It's essential. Am I on my way to produce something that I don't like? Stop it. Now, they are always telling me it's so comfortable. There's no sharp edges or nothing that can irritate them in the mouth. So I would say the comfort using Multiflow is fantastic.
So from a patient perspective,
It's
this is a huge improvement?
Yes, and it's preferable.
Okay, okay. Well, thank you for letting us into your domain, your work domain. And thank you for your time, Flemming.
Yeah, and the same to you.